MEDIHONEY Paste is 100% active Leptospermum honey. Like the gel, it comes in a tube and can be used on a variety of wounds, from superficial to full-thickness wound, ulcers, burns, and wounds around the mouth. This sterile product has a thinner consistency than the gel, which is very suitable for deep, tunneled wounds or for wounds with undermining, or even for impregnating onto a clean antimicrobial gauze or non-adherent dressing and then applying to the wound. It is recommended to use MEDIHONEY Paste with a secondary cover dressing, except in cases like certain burns or mouth wounds where your clinical judgment comes into play. As we demonstrate on this model of a sacral pressure ulcer, after properly cleaning and preparing the wound, MEDIHONEY Paste can be applied directly to the wound bed. This model is an example of a more serious wound where tunneling and undermining has occurred. In cases like this, it is important to make sure the MEDIHONEY dressing has direct contact with the varying wound surfaces. Here, we use BioGuard packing strips to move MEDIHONEY into the tunnel, ensuring contact with the undermined area. In cases like this, it is important to make sure the MEDIHONEY dressing has direct contact with the varying wound surfaces. Here, we add MEDIHONEY calcium alginate to cover and fill the wound bed, being careful to keep the product inside the wound edges. If the depth of the wound requires it, gauze may be used to further fill the wound bed. To finish, we use Extrasorb non-adhesive foam as the cover dressing to offer absorption, cushioning, and protection.